What's going on, guys? My name is Vincent Adams. I'm a physical therapist here at Body Central Physical Therapy. I just did a shoulder pain workshop for y'all, but unfortunately the intro cut out. So just want to introduce myself, and I hope you guys enjoy.
Attention to address your individualized problems, then 100% come on in, chat with us, 100% free. So I would 100% um, try to take advantage of that if you can. But again, at the end, we can address that a little bit more. So let's go over just some of the basics of the shoulder. So first thing is the rotator cuff. So it's the four muscles that are going to help to rotate and stabilize your shoulder. And I see a ton of issues at these four muscles. So it's super, super important that they stay healthy. So we've got the supraspinatus, which is the muscle on top on the left hand. So I don't know if you can see my cursor. And the left side is going to be the back side of your shoulder. So we'll see supraspinatus runs on top here. And then you're going to see this little bony shelf on the right hand side. And you can actually feel it on your shoulder. So you see that little space between the bone and the tendon and the muscle. So that's super important, right? We'll talk about this down the line. This can cause some issues. If this space is decreased here, it can cause some pinching and then potentially tearing of the supraspinatus muscle. So, and we'll talk about, one or two things you can do to help address that if the space is a little bit too small in your shoulder. And then we've got the infraspinatus and teres minor, again, on the left-hand side of your screen. Those are going to be on the back side of your shoulder. They're going to help to rotate your shoulder to the outside, and they work pretty much together. So we can chunk those two guys together. And then the fourth out of four is going to be your subscapularis. And that's the big one in the front. So looking at the front side of the shoulder on the right-hand side, that's going to help rotate and pull your arm to the inside. And he's a pretty big guy, and he does the job on his own. So those are your four. So super important that these are healthy because, again, they're going to stabilize your shoulder, especially with movement. So if you're lifting your arm overhead, these guys are going to suction cup your shoulder into place and hold it steady. So if there is a tear, inflammation, or like a tendonitis in one of these, big problems for the shoulder, right? So you want to make sure these are super healthy. So let's break it down piece by piece, and we're gonna make this interactive, so y'all can do some of these things with me. I'll try to slow it down too, so we can get in position. So again, supraspinatus on top. The function of that muscle is going to initiate the first 15 degrees of abduction of the shoulder. So abduction is going to be arm out to the side. So if we're up tall, it's going to be raising your arm up and out to the side this way. Okay, I'll give you guys a side view too. So to the side, raising up and over. So the first 15 degrees is going to be about here. So if y'all are unable to do this motion right here, or if this is painful, okay, then potentially there's a supraspinatus issue there. And then another test we can do, and these are all going to be a little bit imperfect, so just kind of bear with me. So you can raise your arm up and out to the side in this position, try and hold it, and then slowly lower down to your side. You guys can try to do this with me too. So I'll go one more time, raise out to the side, hold steady, and then slowly lower down to my side. So one, if you're not able to get in this position, if you're struggling to get there, okay, potentially there's an issue there with the rotator cuff. B, if you're unable to slowly lower and control down to your side, okay, potentially there's an issue there as well. Or C, if you suddenly drop or you lose it right here, then potentially an issue there as well. So that's problematic if any of those things are happening for you. So supraspinatus, and this is going to be the most commonly injured muscle that we see in the rotator cuff. So next one, we got the teres minor and infraspinatus. Again, this is on the back side of your shoulder, and these guys, again, they work together, right? They're going to help rotate your shoulder out to the side this way, right? External rotation of the shoulder. And another thing y'all can do with me to test these muscles, you're going to hold your arm at your side, 90 degrees at the elbow. You're going to grasp with your other hand, grasp at your wrist, and then try to prevent external rotation of the shoulder. So you can try to prevent this motion. So I'm pressing out into my hand, holding for a couple seconds, and then relax. And try this with me. So trying to rotate out, holding, resisting, and then relax. And I have no pain there. I don't notice any weakness. You always want to test side to side. Again, 90-degree bend. I'm trying to rotate out, but I'm resisting with my opposite hand. Then relax. Okay, no pain. And it feels pretty even side to side. Again, imperfect test, right? But just give you a general idea. So, no, if this is one side's weaker than the other, if that's painful, if you try to rotate out, then okay, potentially, we have an issue with one of those two rotator cuff muscles. So just to give y'all an idea, we gotta go down. There we go. All right, so infraspinatus, teres minor, external rotators of the shoulder. And then the fourth is subscapularis. So remember, that's the big one on the front side. That's gonna rotate your arm to the inside and then slightly pull you across your body. So internal rotation and then a slight bit of pull across. So to test this one at home, and y'all again can do this with me, you can take your arm and try to reach it behind your back here. And I'm gonna place it on the small of my back. And then from this position, try to lift your arm off your back. Lift off the back. Okay, so I'll try on the other side. So I don't have any pain, no issues getting back there, right? So I'll take my other arm, reach behind my back, place it on the small arm of my back, and then try to raise off my back like this. So if you're unable to get your arm back here, that's an issue, right? If it's painful to get back there, that's also an issue. If you're unable to lift off your back, that's an issue as well, right? So then potentially we have some sort of subscapularis internal rotator of the shoulder issue, right? So again, if any of these four are dysfunctional, you want to address it now, because if it's been, if it's been a couple weeks, you've been painful, dysfunctional on the shoulder, and it's not getting better, it's not going to get better unless you actively do something about it. So, that's why I always recommend, seek out a physical therapist if you have shoulder pain, because it's going to cause you issues down the line. Okay, so that is the rotator cuff. So now let's go into just some of the joints for the shoulder. So there's 4 joints in the shoulder, but we're going to go over the 2 main ones. The first one on your top left side here is the glenohumeral joint, and you can see it's a ball and socket joint. So you can see the long bone on the side, that's your upper arm, and then you got your scapula in the back, which is your shoulder blade in the back, and it's gonna rotate and move within that socket. So you can think about like a golf ball sitting on a golf tee. So it's extremely mobile, the most mobile joint in our body, but that comes at a price of stability. So, we've got the ligaments in the joint capsule to provide inherent stability to the joint, and then we've got our secondary stabilizers of the rotator cuff. So, if there's rotator cuff damage, there's going to be instability at the shoulder joint, and that can cause a whole array of shoulder issues. So that is the glenohumeral joint on the left side. And then if we look on the right, we've got the scapulothoracic joint, and that's going to be your shoulder blade in the back. And this is looking from a backside view, and it's going to articulate with your rib cage. It's going to slide and rotate and go up and down on the rib cage, and it's going to work with your glenohumeral joint for different shoulder motions. So if we have dysfunction here at the scapulothoracic joint, and there's a ton of muscles that work with the scapulothoracic joint, we're going to see issues at the glenohumeral joint and just have general shoulder dysfunction and pain. So something that you don't want to deal with. So let's look at the basic motions of the shoulder. So we've gone over a couple already. So we're going to look at the glenohumeral joint first. So we've got flexion, extension, abduction, external rotation, internal rotation. I put some different degrees here on the screen. And these are going to be, your varied degrees of normal, right? Everyone's going to be different. Everyone's going to be 100% different, but you want to try to fall somewhere within these ranges, and you want to be pain-free within these ranges. And these are going to be functional ranges for you. So let's go over the different shoulder motions and do these with me, y'all, too, so you can see. So we have, the first one is flexion. So that's going to be straight up in the air. Flexion. Do this with me. I'll give you a side view too so you can see. Flexion. all the way up in the air, and then back down again from the front. And see, I'm getting up to, maybe 170, 180, and I'm pain free, all the way through. So hopefully that tells me I got a healthy shoulder joint. But if y'all are having pain anywhere within this range, that's an issue, all right? Second one's gonna be abduction. We just went over this before. It's gonna be up and out to the side, this way. And make sure you're turning your palm towards you. If it's turned this way, that's gonna cause you pain because there's gonna be tension in the shoulder. So you gotta rotate it all the way out. Up and out to the side, and then back down. We're gonna turn the other way so you can see. So again, up and out to the side, here, and back. If you find yourself kind of coming out here and you can't truly get back here, no, that's also an issue, right? We got something dysfunctional going on with the shoulder, all right? Abduction, and then we got rotation. So again, external rotation, and then internal rotation. So internal rotation, right? If you want to put a belt on, you got to be able to get back here. External rotation, with a little bit of flexion or abduction to get back here. You want to wash your hair, put your shirt on, anything like that. You got to have that motion pain-free, right? And then extension is going to be the opposite of flexion. It's going in a backwards direction this way, right? And so hopefully, we can test you here in the clinic for the different ranges, but hopefully y'all fall somewhere within, those ranges and you're pain-free throughout the entire motion. If not, problematic. So, and one thing I wanted to add on the left-hand side, remember we talked about the slide before, that the scapulothoracic and the glenohumeral joint work together. So for abduction of the shoulder, remember the one up and out to the side, you're gonna see for every 2 degrees of glenohumeral rotation, we're gonna see 1 degree of scapulothoracic rotation. So if that scapulothoracic joint or your shoulder blade in the back, if it's not rotating upwards with your arm as you raise, you're gonna get tension and pain somewhere within that range, and that's an issue, right? So we got some kind of scapular dyskinesia there. You got some kind of dysfunctional musculature that's going on, and we want to address that early, sooner than later, right? Because that's going to cause wear and tear, inflammation, pain, and potentially a tear down the line. So all bad. We don't want that.
Water.
Yes. Sorry, just give me a sec. All right, so scapulothoracic joint. I've touched on this a couple times now. So there's a bunch of different motions that we can do, and do these with me as well. So we'll go through sequentially. So first one is going to be elevation. And again, we want all these to be pain-free, right? Pain-free and smooth. So elevation is bringing your shoulders up. So you're going to bring in direct line up. Depression will be pushing them down. So if elevation's up, depression's going to be opposite. They'll be neutral and then push down. Depression, we've got upward rotation. Again, that's going to be the shoulder blade rotating. So as you elevate your arm, your shoulder blade should rotate with your humerus. And then as we come back down, it's going to be downward rotation. So they'll be up and rotated, and they're going to come back down and rotate down. Then we've got retraction, which is pulling your shoulder blades back, retraction. And then protraction is pushing them forward this way. So from a side view, retraction, tucking back, and then protraction is rounding forward. And most of us are probably stuck here in protraction anyway, so we need to be going back into retraction. We're going to talk about that in the exercise piece. So those are just some of the basics, just basic movements, basic muscles, but there's a lot that goes into it. And then let's look at normal posture. So super important, right? Super important. We're trying to emphasize a normal posture because that's going to decrease the wear and tear on your spine, on your joints, on your ligaments, on your muscles. It's going to decrease your injury rate too if we're in a better posture. So I emphasize this all the time, all the dang time. So if we look at here on the left-hand side, from a front view, you're going to see that the ears, the shoulders, and the hips, they're all in line, right? So that's nice, good posture, right? I'll see a lot of kind of tilting. It's like one shoulder is gonna be higher than the other, or one hip's gonna be higher than the other. And potentially what that's gonna do, and you see this nice normal spinal alignment on the left-hand side, that's gonna push you into more of like a lateral deviation, so some kind of scoliosis, which isn't gonna be healthy. It's gonna cause, increased wear and tear over time. So, something you wanna address there, if there is some kind of, and you can look in the mirror and see if there is kind of, and just eyeball it, and see if there is kind of deviation there. So if we look at the top right picture, from a side view, we're gonna see that the ear, the shoulder, the hips, and the ankles are also all in line, which, for most of us, this probably isn't the case, right? You probably see a little bit of that forward head, rounded shoulder, maybe a little bit of the extra, arch in the low back. So, but this is nice neutral alignment, both of these photos. So you want to try to emphasize this, as much as you can, and try to get into this posture as much as you can, then stabilize there. Make sure you're strong and healthy within this posture. And because it's going to show here at the bottom right, it's going to emphasize your normal spinal curves. Now, when you're in a nice normal posture, so you see the nice cervical, thoracic, and lumbar curves, that's a good healthy spine right there. And that's going to be, longevity, right? Function and longevity. That's what we're all going for. So, normal posture, super, super important. So if we go into dysfunction, right? So we'll jump into some of the shoulder problems we're going to see. First one's going to be upper cross center. So that's the opposite of that normal posture we just talked about. And this is probably a lot of us to some degree. And I know this is me a lot of the time too, and I have to fight this a lot. So it's going to be, see that forward head on the right-hand side, you're going to see that forward head, rounded shoulder, and then the increased curve on the low back. And everyone's going to have this to a different degree, but I see this all the time. So you're going to have, neck pain, because you look at all the increased tension on the neck muscles there compared to the guy on the left. Probably see headaches of the cervicogenic nature. We'll probably see low back pain for this guy as well, because you can see he's got that anterior tilt where his hips are tilted forward. So he's just sitting on his low back joints, and that's going to cause some pain and dysfunction over time as well. And we'll also see restricted movement in the neck and shoulders. And you can see why. We can do this together too. So if we go, so I'm going to round, right? So I'm going to go into his posture. So I'm rounded forward head, and I'm going to try to raise my arm up, and I'm getting stuck, right? This is as far as I can go. But if I'm to open my chest up, boom, I can get all the way up. No problem, right? So again, if I'm rounded forward, I'm stuck. But then I'm going to open up my thoracic spine, and bang, I can get all the way up. So, we want to get, it all works together. Spine and shoulder, everything works together. It's a system. So if one part's off, we're going to see problems in different areas of the body. So normal posture, y'all, we got to work on that. So let's go over, one or two things that y'all can do at home if this is the case, if this is something you got going on. First one, we'll just do in a chair. Really, really easy. Again, y'all can do this with me if you want to pull up the big screen. So we're going to sit in a chair. What you want to do, if you're tight here, we want to try to open up the chest and pull the shoulders down and back. Because good posture, shoulders down and back, head up and back, right? So we're going to go here, try to rotate your arms out to the side, open your chest. I like to do like 5 to 10 second holds, and then I'll ease off about 10%. I'm not coming all the way back down to that dysfunctional. I'm just trying to open up, rotate, and you may feel a ton of tension through here, like, man, that does not feel good. But that's fine, right? That's normal, because you're used to being here. This is your normal. That's what your body's used to. So we got to create that new normal and get you opened up. So open up here, and then relax. I'll do 5 to 10 second holds. 10 to 20 times. You can do this multiple times per day. So from a side view, I'm going to open up, rotate my shoulders out. See how my chest is opening up. I'm pinching my shoulder blades together at the back, and then ease off about 10%. So again, open, 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 open. Hold for a couple seconds, and then ease off. So, and then, yeah, shoulders down and back, always, right? So that's an easy one. Another one you can do on the floor. So I'll take like a mat, like a broomstick, or we have a dowel rod here in the clinic. I'll go down onto my stomach here. And we'll take that dowel rod and put it behind our back. And I'll grab it with both arms. And what I'm trying to do is try to pull my shoulders. I'm squeezing my shoulders together, trying to pull off the mat as I pull my head up. Again, hold for about 5 seconds, and then back down. I'll show y'all about 5, just so you can see. So pull down and back, head up, and then relax. Again, tuck, pull it up. And this is one of my favorite postural strengthening exercises. One more, pull up, shoulders down and back, squeeze, and then relax. So that's gonna help strengthen your posterior postural muscle. So a lot of times I'll see though, when people do this, they'll pull up and then they'll arch their head way up like this, which is what you don't want to do. So you want to keep head down towards the floor and do a tuck. But you're always looking straight down towards the floor when you're doing it. So that's a little bit more of an advanced version. But one of my favorite postural strengthening exercises. So upper cross syndrome. All right, so next one is instability. It's another common problem that I see, so I'm a little bit out of breath now. So what we're gonna see with instability is a little bit of extra movement with the shoulder joint, and that's because there is essentially a stretching out of the static stabilizers of the shoulder. So you can see like a weakened joint capsule, or potentially we'll see a stretching out of the rotator cuff muscles. So you don't have that stability of the shoulder joint, which is problematic as well, right? So some symptoms that you may see, you're gonna feel like almost like your shoulder is slipping in the socket. May feel like it's given way, during certain activities. That's especially gonna be with overhead stuff, and then things outside of your base of support that you're gonna see that. We'll see shoulder pain, of course, and then potentially we'll see recurrent dislocations, which is when the glenohumeral joint goes out of socket. We'll see subluxations where it goes a little bit out of socket and then comes back inside. And again, this can be from a chronic issue or a acute traumatic, which is what I had, is from a soccer goal, dive and save, and then it pops out of socket, and then now I have instability, right? So if there is instability within the shoulder, we want to go the opposite way then with physical therapy techniques, right? We want to build stability, with our dynamic stabilizers, the rotator cuff, right? So what are things, we can do, for this, with PT and on our own, right? So let's go over to the wall and I'll show you. So if you guys have like a wall or a space you can use, and like, I'm gonna use a towel. Oh, thank you. Well, give us a second, we're gonna get set up. So I just got a towel, and then we're gonna use just a basic wall here. Okay, so let's say my left side, right? That I have instability, it feels like it's slipping. Ouch, no good, right? So I can take my towel, I'm gonna make a fist, and then put it right on the towel here. And then I'm nice and strong through my shoulder, so I'm not collapsing into it, and my elbow isn't bent, so I'm not doing, this thing, right? So good and strong. Now I'm engaging my shoulder in the back, and then we're gonna do circles. So just little baby circles. And now I'm not pushing all my weight in. I'm doing like maybe, 10, 15 pounds. So I'm gonna do little circles. At home, 10 to 20. For here, I'll just do a couple. So go like 10 one way, and then I'm gonna go 10 the other. Then I can really feel that work in my shoulder in the back. And this is gonna work on stability of the shoulder. If this is really painful for you, then maybe you're not ready for it yet. And that's how you come to PT, because there's whole sequences, there's regressions, progressions on everything, right? So we don't just jump into a program without knowing what we're doing. So circles and circles. I can feel that really start to work. So circles are really good. And we can also do little crosses. So I'll go like up and down 10 times, and you can go across the cross. Or you can even do like alphabet, right? So like A, B, C, and work your way all the way through. I would do, 10 to 20 circles, crosses, or like one-time alphabet, once or twice a day, potentially. And that can help, start to improve your shoulder stability. But again, there's a whole array of stuff that you can do for that. So, but just to give y'all an idea, how do I pull up the share? Okay, just click it. Okay, alrighty. So instability just gives y'all a little bit of a overview there. So next one, rotator cuff tear. And it can happen to any of the 4 muscles of the rotator cuff that we talked about at the very start. But again, supraspinatus, the one on top, remember the one that starts that first 15 degrees of abduction? That's going to be your most commonly torn rotator cuff muscle. And we'll see here, the picture on the left. So it can either be, a partial thickness tear where it's just a part of the tendon or a part of the muscle tears, or it can be a full thickness tear where the entire tendon or the entire muscle tears, right? So there's going to be degrees of tears, and they can be asymptomatic too. You could have a tear right now and you don't even know, unless you get some kind of imaging or diagnostic testing done. So symptoms that you're going to have, commonly you're going to see a lot of pain at night when you're trying to sleep. If you're trying to lie on that shoulder, that's going to be painful for you, and then you also have pain at rest, right? You're going to see, again, pain. You're going to see weakness in the shoulder. A lot of times I'll see that kind of upper trap compensation where you're hiking that shoulder up and trying to raise your arm to get that little bit extra because your cuff is torn and it's not working functionally, right? You'll see a loss of motion, so you may not be able to get up into those upper ranges. So it's like, hey, I can't get up in the, the cabinet and, put the dishes away, or that's really painful. Potentially we got a cuff tear there, right? Problematic. You're also going to see a lot of stiffness and tenderness, and you're probably not going to want to move your shoulder. And that's just going to, continue, the degeneration process. So movement, mobility, strengthening to your tolerance level is what you want to do. If y'all are just being stagnant and guarding that thing for weeks on end, that's a huge issue, huge issue. So yeah, if you're doing that, come see me, please. Don't let it get worse, because it will not get better unless y'all do something actively about it. So, okay, so exercise for cuff tear, right? Basic, low level, what's something I can start with at home. So we're gonna shift to the wall here. Again, if you have a wall at home, y'all can do this with me. So I'm gonna use, and I'm gonna flip arms, but you wanna do it, if this is my dysfunctional arm, you wanna do it on the dysfunctional arm, but just for sake of y'all being able to see me. So it's gonna be an isometric. So an isometric is when I'm doing force against something, but my joint isn't actually moving through a range of motion, right? So we wanna work the rotator cuff and start to strengthen the rotator cuff. So we're gonna do isometric internal rotation, isometric external. So I'm gonna start with internal on my left-hand side. So again, towel. Here, it just makes it a little bit easier on your hand. What I'm gonna do is get nice and close. So again, 90-degree bend at the elbow, and I'm gonna try to push into the wall. Again, hold for about 5 seconds, and then relax. I'm pushing into the wall. So this is gonna work my internal rotators. And then relax. Again, 10 to 20 reps, something like that. I'll do a couple here. And then relax. And, I go, start at about 25% max force. And then if that feels good, if that's easy, then we can go up to like 50% of max force and then 75. So again, progressions, right, as it gets easier. And then relax. So internal rotation, resisted, right? And then we can go the opposite way for external. And then I would want to do on the left side, but I'll just show you here on the right. So again, bent, I don't know if y'all can see that. So I'm here in this position, 90 degrees, and I'm not out here, right? Doing this nonsense. It's shoulders down and back, rotating here in a good position. So I'm here, and then I'm gonna try to push. I'm pushing my fist into the wall. Hold for 5, and then relax. And then push, 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 push. And then relax. Again, a couple reps, do one more. Push, push, push. And then relax. So, just a basic, easy, rotator cuff strengthening activity that y'all can start to do at home, right?